Hey everyone, welcome to another question and answer session regarding MRCS exam. Which of the following nerve is not contained within the posterior triangle of the neck? So we have to find out from here there is the which is not located or which is not contained in the posterior triangle of the neck. So first of all, we have to know details about posterior triangle. Then it will be easy for us to answer the question. So here are the options. The options are accessory nerve, phrenic nerve, greater auricular nerve, ansa cervicalis, and lesser occipital nerve. So now let's see. You can say this is the posterior triangle of the neck. This is the posterior triangle of the neck. It is bounded anteriorly by this broad muscle. This is the sternocleidomastoid muscle, and it is bounded posteriorly by this muscle, and this is the trapezius muscle. So anterior boundary, it is formed by posterior border of sternocleidomastoid. On the other hand, the posterior boundary, it is bounded by the anterior border of the trapezius muscle. And in the lower part of base, it is formed by this bone. So this is the clavicle, and at this part, this is the medial third of the clavicle. So it is inferior border, or it is base is formed by the middle third of the clavicle, and apex is, or upper part, it is formed by the junction of these two muscle. On is the This is the sternocleidomastoid muscle, and this muscle is the trapezius muscle. And the space between the sternocleidomastoid muscle and trapezius muscle, this is the posterior triangle of the neck. And this posterior triangle of the neck is also divided into upper larger part, which is the occipital triangle, and lower smaller part, which is the subclavian triangle. So occipital triangle and subclavian triangle, and this division is occurred by the inferior belly of the omohyoid muscle. This is the omohyoid muscle. So a omohyoid muscle is divides the posterior triangle into the upper occipital triangle and lower subclavian triangle. So here we can see this is the posterior triangle of the neck, and in the posterior triangle of the neck there are the several structures, such as one of the most important is the accessory nerve. Here we can see this is the accessory nerve, and here we also can see some cutaneous nerve which is arising from the posterior triangle of the neck. So here it is in short about the boundary of the posterior triangle. Apex, that means the upper part, it is formed by the two muscle. One is the sternocleidomastoid muscle, another one is the trapezius muscle. Then anterior boundary, it is bounded by the posterior border of the sternocleidomastoid, and posterior boundary, it is bounded by the anterior border of the trapezius, and base or lower part, it is formed by the middle third of the clavicle. Now here the contents. Here we can see the different nerve here present. The most important here, this is the accessory nerve, which is 11th cranial nerve, or 11th number of the cranial nerve. Then we can see the phrenic nerve. Now this phrenic nerve, it supplies the diaphragm, and it starts from the neck area, and it finally reaches into the thorax. And then three trunks of the brachial plexus, then branch of the cervical plexus, as a supraclavicular nerve, transverse cervical nerve, greater auricular nerve, and lesser occipital nerve. So greater auricular, lesser occipital, supraclavicular, and transverse cervical nerve, they are branches of the cervical plexus. So here brachial plexus, cervical plexus, and accessory and phrenic nerve. So this 4 point is very important, that accessory nerve, phrenic nerve, brachial plexus, and branch from cervical plexus. So this 4 nerve is very important content in the posterior triangle of the neck. Then we can see the vessels. This is the external jugular vein and subclavian artery. So these two important vessels present in the posterior triangle. One is external jugular vein, another one is the subclavian artery. And muscles, it is the inferior belly of the omohyoid, and we know that the inferior belly of the omohyoid, it divides the posterior triangle of the neck into the occipital triangle and subclavian triangle. And the occipital triangle is the larger triangle, and subclavian triangle, it is the smaller triangle. And we can see some lymph node here. The one of them is supraclavicular and occipital. So they are the content of the posterior triangle In short, again, the nervous component is very important. One is the accessory, another one is the phrenic nerve. Accessory, it is the number 11th cranial nerve, and phrenic nerve, it arising from the cervical area. Then we can see branch or trunk of brachial plexus, then cutaneous branch of the cervical plexus, and we can see some other vessels such as the external jugular vein and subclavian artery, and muscle inferiority of the omohyoid and scalene, and lymph node, supraclavicular and occipital group of the lymph node. Then in this picture we can see the different parts present in the neck. Here we can see the hyoid bone, and above the face and lower part here the clavicle, and below the clavicle there is the chest, and we can see the some structure in the this triangle, and we can see this is the ansa cervicalis, and this ansa cervicalis is lies anterior to this vessel. This is the vein which lies in the neck area. So it is the internal jugular vein, and ansa cervicalis is lies anterior to internal jugular vein, and we know the vessels here, the external jugular vein and subclavian artery. So as it located anterior to the internal jugular vein, so it is not content of the posterior triangle, and it lies superficially. So it is superficial structure, not located into the posterior triangle of the neck. So here in another picture we can see this is the different structure here, and we can see this is the cervicalis, ansa cervicalis, which is more superficial, so it is not located here. Here we can see the hypoglossal. The hypoglossal lies more above, so it also not located within the places. So here our final answer is the ansa cervicalis, because ansa cervicalis is not located into the posterior triangle of the neck. And we can see the other structure such as the accessory nerve. We know the accessory nerve, it is cranial nerve number 11, so it is located into the posterior triangle. Then we can see the phrenic nerve. This phrenic nerve also located into the posterior triangle of the neck, and it supplies the part of the cestole and the diaphragm. Actually it supplies the diaphragm mainly. Then greater auricular nerve and lesser occipital nerve. This two nerve is well acquainted to us, because the lesser occipital nerve and greater auricular nerve, they are the cutaneous branch of the posterior triangle of the neck, and this cutaneous nerve arising from the deep to the posterior triangle of the neck, then it comes forward, and also it supplies in the anterior triangle part and rest of the part of the neck area. So this two nerve is very important: greater auricular nerve, lesser occipital nerve, with the some other nerves such as the transverse cervical nerve and supraclavicular nerve. In the picture we can see here, these are the cutaneous branches, it arising in the posterior triangle, then it supplies in the different part of the neck area. Here we can see they are supplying in this area, and name of this here, this is the lesser occipital, greater auricular, this is transversely placed, so transverse cervical, and there in the lower part it is the supraclavicular. So our answer is ansa cervicalis, because the rest of the structure are present in the posterior triangle. And we can see the all options they involve here the nerve. So the nerve compartment is very important for posterior triangle of the neck, because the muscle, lymph node, and the vessels content are usually not much more important for the posterior triangle. Thank you for